The Pediatric Lounge, a podcast taking you behind the door of the physician's lounge to get a deeper insight into just what docs are talking about today. From the clinically profound to the wonderfully routine and everything in between.
Well, hello again, and welcome to the Pediatric Lounge. This is your host, Dr. Herb Bravo, and with me today is our co-host, Dr. George Rogu. We'd like to take a minute to thank the audience for listening and supporting us over the past first year. This week, we celebrate our first anniversary, and it could not have been possible without the support of the wonderful audience and the many pediatricians and people who support pediatrics who have been our guests and have had very candid and meaningful conversations throughout the year. We hope you continue to support us, and we hope that you follow us along for the second season. With us today is Dr. Kerry Fierstein, CEO of Allied Physicians and CEO of Adjuvant Health, a true leader among leaders, and especially a leader in pediatric medicine in the United States. So let's listen to our last show of the season. All right. Well, hello, George. It's Tuesday morning, and we're at the headquarters of Allied Physicians in Adjuvant Health in Long Island, New York.
Today we're here with the great Dr. Kerry Fierstein, and she's going to speak to us today about lessons learned from leading the pediatric supergroup.
Welcome, guys.
Welcome, Kerry.
Thank you for making the trip to Long Island.
Love it. We've been trying to coordinate this for a long time, and it's always something goes wrong at the last minute. Yeah, it's great to see you in person, and this is going to be our 1-year anniversary show. So you're a very special guest.
You guys have done amazing things. I enjoy the show every week.
Thank you. So we always start with, why did you become a pediatrician?
I became a pediatrician because I love kids. So I was either going to be a nursery school teacher or a pediatrician. And truthfully, my choices growing up, as a smart Jewish girl, were doctor or lawyer. So it went to doctor, and then pediatrician was easy.
Wow.
Most of the doctors have the same kind of story. I grew up, I like kids. It's a good story. It's a common story.
I didn't. My mom said, you either be a lawyer like your dad or a doctor. And when I was a doctor, I said, I really like internal medicine, but I'm not going to put up with adults the rest of my life. So,
Yeah.
For a while, but really liked general pediatrics. And always knew that I would go into private.
Do you think pediatrics is a good profession for us, or?
I think pediatrician is an amazing profession.
Yes.
We get to watch children grow up and influence their lives, change their future. We get to have fun every day. We get to wear silly hats and blame it on the children. And I think it's wonderful.
Yeah, we are the rock stars of medicine, I guess.
Yes. And I do think that financially there is money to be made in pediatrics. You don't go into it for the money. And sometimes it is aggravating to see people you went to school with who, you know what they're capable of, and financially they're in a different place than you are. But I enjoy what I do every single day, and I wouldn't give that up.
yeah, I think the money may not be as great as other, investment banking and so forth, but you feel great about what you do every day.
Myself, in investment banking, I can tell you that the money is not as good as investment banking.
Right on, but that's the beginning. They make a lot of money out of the gate. And then as they get older, if they didn't make a lot of money in their younger years, when they become old like you guys, not me, you become put out to pasture. You're already outdated and too expensive, and you get replaced very easily. So we are still in our prime.
Well, that's how Don Lemon got in trouble.
Why?
He said Nikki Haley was past her prime.
Oh,
and no.
I said me.
No, you said
Yes, I am.
you are.
We are. So, no, we're all in our
You're
prime.
not,
We're all
clearly.
top guns.
So you went from the examiner to leading your pod or your smaller practice to being the CEO of Allied Physicians in Adjuvant Health. What motivated you to make that transition?
I was always interested in the business aspect of medicine. My dad was a business owner, and he made glasses and had a conveyor belt and an assembly line, and it was a small business, but it was always a big deal to be a business owner, and I was always business minded. I like math as much as I like science, so that was where I went. Pediatric Health Associates it was actually my second group. I left someplace and we came together, some friends, and we created this group, and we were very successful, and I was running it, and I had great partners, and it was wonderful. And we got to a point where I looked at the landscape and said, we will be better off in a larger group. This was a time where they were starting to take away your reps. Like, you couldn't get an Oxford rep on the phone. We couldn't get a contract. So we looked at it and said we wanted to join Allied. We actually looked at them once and didn't join them. And then a year and a half later, we went on to join them. Allied's lawyer happens to be one of our patients. So he was behind the scenes kind of talking in our ear, and we looked at them again. And once we joined Allied, we wanted to influence the direction it went. And every group is looking for leaders, from Hadassah and the PTA and Allied. And if you want to get involved, you can. So all of my partners, we got involved, and Allied is run by committee. So we were on the finance committee and the EMR committee and the HR committee. And I started going to everything. And, when I'm somewhere, I get involved and you hear my opinion. And over time, I became the treasurer. And then I went from the treasurer to the chief medical officer. And then when Gary Merkin needed to step down from chief executive officer because of family problems, I stepped up. So that's when I became the CEO of Allied. At that time, we were doing all of our management external to Allied. So we didn't really have any employees. And we started to realize that that wasn't a good way to go, because the people that we depended on really had their allegiance someplace else. So we started to build an Allied management internal. We hired people for that. And we had a COO, and he was basically running the Allied management. And then we decided to externalize our management into another corporation, and that became Adjuvant.Health. And we weren't sure why we were doing it, or at least I wasn't. I think our COO at the time probably was. But, if you want to get outside investment in New York, because it's a corporate management of medicine state, you need that external place for them to put the money. So we created Adjuvant.Health, and he became CEO of that. And then at some point when he left, I took on those CEO responsibilities also. So I'm CEO of the medical group, and then also CEO of the management group.
Wow.
And then this past year, Allied decided to partner with a private equity group. And we're now part of the Care About family, which is funded by Ascend Partners, which is primarily run also by physicians. And that could probably be a whole separate podcast, right?
Yes.
And I know you've had some of those,
We had
right?
Dr.
Talking
Monish.
about, we've talked with Dr. Monish, but you've talked about private equity and all of that. And I think it's all about alignment and choosing the right partner. And
Yes.
I'm confident that Ally did, and time will tell.
Yes, it's a very individual decision. So you had a very similar journey to what we're seeing now, right? The doctors join a health system, and they're in a practice. They're in there for 5-10 years. They can't really influence the decision making, and then decide to start up their own practice. We're seeing a lot of that in the marketplace right now.
Okay, yeah, I was never in a hospital system.
But you were in a first practice, weren't happy, and then built your own.
Yeah, for different reasons.
Yes. Okay.
Which could also be a whole other podcast.
We'll invite you back for that.
So why is it so important that physicians be the leaders of physician groups?
I think physicians need to be in leadership. I'm not sure that they have to be the leaders, the ultimate leaders, because it does take time away from practice, and it really depends on what your joy is and where you find it. It's hard to do both really well full time, right? But physicians know medicine, they know patients, they know how other physicians think. So physicians need to be involved in making decisions about how things happen. And that I think is really key for keeping physicians happy, and keeping physicians happy is key for getting anything done in a medical.
I think in the hospitals and the systems, they're run by suits basically. And they tell the physician what to do. And the physician really doesn't like being told what to do. Well, we know that. But I think physicians accept things a little bit better if it comes from another physician, because that physician felt the pain, did the residency, went to school. They know exactly, they know your shoes, where an MBA doesn't really know.
Well, it's also, why are you making the decision? Right? If the MBA is making a decision that makes sense for patient care, then it's much easier to get the physicians on board. But so often that's not
the case,
because that's not where they're focused.
They make the focus on money care.
Right. And as you always say, and I believe this, take care of the patient and the money will follow.
Yep.
But the way we get buy-in is we give physicians the opportunity to have a voice even from the beginning. And like I said, we're committee structured. So any of the partner physicians were able to come to a committee, have a conversation. And for the most part, we made those decisions there. And then, they would get presented to the board if they needed to, and the board would approve them and we would enact them. And then if somebody wanted to complain, you were able to say, listen, you should have come to the committee. And if something big is happening, we're making changes in compensation, or we're making changes in our quality matrix, which is how we work on quality and deal with the incentive programs and things like that. We will, give everybody a heads up. Hey, this is an important meeting. You might want to come to that. And then if you don't come, it's really harder for people to complain, and they understand that. And then each committee has a chair, and that chair is a physician. And that chair has a dyad. We work in dyads, which is an administrator. So if a physician then wants to complain, or they have any concerns, then they can complain to, their fellow physician, which a lot of physicians are happy to complain, quote unquote, to the suits or the administration, but are less likely to complain to a fellow physician as well.
True. And I think it's a leadership philosophy. Like in the hotel industry and the restaurant industry, you cannot be the managing partner of a restaurant until you have worked in the kitchen and the bar, served tables. Same in the hotel industry. You have to know how to make a bed, what the standard is for a clean toilet, how to greet a customer, how to check them in, how to get their luggage to the right place. That's one type of leadership. And I think in some ways it's inefficient, but in some ways it does give you credibility, and you understand what people's pain points are at every different position. So I think when a physician is in leadership, they understand the pain points of seeing patients. When it's just an administrator who has never had any clinical experience, they're just looking at numbers and data and trying to figure out how to maximize margins. And they don't really have a real world impact idea of the world impact of that.
Right now, we took different oaths. Right?
Yes,
Yeah.
their oaths are to make money. Ours is to take care of patients.
But using what you said, I do think it would be great if we had some of our doctors answer phones at the front desk, because they do not understand the pain that goes on there.
That's a good idea.
Yeah.
Because how many times do you get the physician that complains to the manager, why did the secretaries book this appointment? It shouldn't have been there.
Right.
They don't know what happened in that conversation.
Right. And I think they should work some denied claims. They don't have to do it for 6 months, but they could, they could do it for one day when they join the practice, go spend 2 days working denied claims to understand how frustrating it is.
That could be a cool project to do.
Yeah.
I might.
Finger stick on a squirming toddler.
Yeah. And why do you think physician independence leads to better care in the community?
Well, for some of the reasons that we talked about, right? It's where the emphasis is. If the emphasis is on patients and patient care, that's going to be better than if the emphasis is on the bottom line. And something just as simple as being able to refer to whoever you want. In the hospitals, that's not really the case. And whether it's a written rule or an unwritten rule, I don't know, but it becomes something where the referrals stay in-house. And there was a recent email that was sent, well, not recent, it's a few years old now, but by one of the groups in the area that's that's owned by a larger conglomerate, and they basically said you have to refer in-house, and that's just wrong.
Yeah, I've seen plenty of discharge summaries from their newborn nursery that have a system name on it, and they come to our office with their other 5 children. Same thing with emergency rooms, specialists, and so forth.
Yeah.
It's pretty disturbing.
Yeah, their compensation is tied to leakage.
Right. It's not written, it's an unwritten rule.
Which is such a terrible word.
Leakage, yes. What is servant leadership, and why do you think it's important to practice that when you get to your level of management?
I think servant leadership is important at every level of management. And servant leadership means you're doing what you do for your stakeholders, whether your stakeholders are the other physicians or the patient, the parents, even the executives and the administrative people that work for you. It has to work for everybody. It can't be about you and what you need. It really has to be about the goals of the organization and what you're trying to achieve.
So a lot of what a servant leadership leader does is remove obstacles so their team can be successful, right? But that's a big part, right? Just get the right, get people to be able to perform at their peak performance, and take the view of what is necessary for my team to succeed, what's necessary for my patient to be healthy. How could I provide the best customer experience for the parents? And when you do that, I think you're quite successful. As we talk to a lot of pediatricians around the country, a couple of words keep coming up, and one of them is relationships. I think we all think relationships are extremely important. What are your thoughts about the importance of relationships?
Well, I think in the context that you're talking about it's the relationship with the patient and the patient family. And that's clearly key. We know that the number one reason a patient gets a vaccine is because it's recommended by their pediatrician. So that's key, but relationships are also key in business, right? If you want your executive team to perform and be the best that they can be, there has to be relationships involved. It can't just be a working, time to work and you just talk about work and you go home. People do things for each other because they want to, because they like to. And especially the workforce demands right now, right? People really could go work anywhere. They have to choose to want to work with you and for you. And that's because of relationships and communication about mission and feeling good about what you do every day.
And how important do you think, and we had this conversation with a medical student, passion versus money? Should you follow your passion or follow the money?
I firmly believe you have to follow your passion.
Yes.
Yes. And if you follow your passion, the money will follow within reason.
Yes.
We have students that come to my office and they're all following the money.
Yeah, it's sad. I think they're going to burn out very quickly.
They're all following the money.
Yes.
Well, in their defense, they have very large student loan burden to deal with. I don't know how you guys do it at Allied, hiring physicians. How many kids come to you and say, I have a student loan, can you guys offer forgiveness? You can't in private practice. That's the problem.
My office just lost a great candidate. And specifically because of student loans, he
Yep.
told me he has $500,000
Oh,
in
geez.
student loans.
We lost that same candidate for the same
Yeah.
reason. And he was our patient
Right.
as a kid. He came to us from birth. So the ideal job would have been to work with us, but we lost him for the same reason.
Yeah, I'm sure that's a passion money issue because you could be just as passionate doing pediatrics for the hospital as you can be passionate doing it.
Yes.
I think it's choosing to go into a field where maybe your passion isn't. And that's a problem because days are long and years are longer. And
Yes.
you have to want to get up every day, or if you don't, it's really sad.
Yes.
Yeah, but it bothers me to no end why the systems have the loan forgiveness, yet we all, RBK and Allied, service the same population of people. They're across the street.
Well,
Why?
I
And
think
it's
it's
the same
time we
job.
start having the moms call the congressman
Yeah.
and ask them why.
That was the conversation, right? You had with
With Colleen Crab.
Yes.
And that was a phenomenal idea. So
Yeah.
it's incumbent upon all of us to ask the parents. We can't hire new pediatricians because we can't forgive their loans. Could you call your congressman and let them know?
what's helpful is I have a newborn and where am I going to take them?
Yes, but I think people will listen. I think people will listen. Politicians don't like it when healthcare is not working in their community because I'm sorry, I'm
It's
sound
okay.
terrible, but it's moms that decide, and moms are very valuable to politicians because they're very involved in their community. And so when a mother complains, they're very worried. When I complain, they're like, "Oh, he's just another angry white guy." It's true, but
It's not that.
but when the mom complains, it's a problem. It's a problem for the health system. It's a problem for the politician. It's when I complain, I'm just a disruptive doc. And so Allied has values that are expressed on your website, and number one is respect.
Yeah.
And what do you mean by respect? How did the way we communicate with each other, respect to the values of the company?
Respectful communication and being respectful to each other
Okay.
is key. And we actually do some internal courses on that, and one of them was on respectful communication.
And then number two, which is extremely important, integrity. Why is that important?
We just had a young doctor, and we have teams and we have a clinical where anybody can post anything. And she just posted that a parent wanted to drug test their child, their teenager, without telling the teenager. And this, young doctor was concerned about that, and it's not something she'd ever done or wanted to do. But it's not illegal. And she asked about that. So, what should you do? And the support that she got from the other doctors was, you have to be true to yourself and to your values and to that relationship with that child. So that integrity, is important in the doctor-patient relationship. It's also, all of the things that we just talked about in servant leadership. Integrity, when I say something, people need to know that it's going to happen.
Yes.
And all of us, if we say something, it's about accountability, right? Integrity and accountability can go together. You have to be trustworthy.
Yes. I read a book, but I can't remember if he started. I don't think it was KKR, but one of the huge private equity firms. Very similar to your story. He's Jewish. He grew up in Philadelphia. His dad had a store that he worked at since he was a young kid. And then, he built this empire to billions and billions. And he says the first lesson of hiring is hire people who have integrity. Because a very smart person without integrity can take your whole business down in a couple of weeks. So that's the one thing you always want. You want honest people around you, and you can teach them. A above average person who has lots of integrity, you can teach. A super smart person with no integrity will bring down your whole business. It's a very, very good lesson. In compassion, how do you express compassion? Not in the exam room, but within the management team.
It's listening to each other's stories. It's hearing them and understanding where somebody's coming from.
Okay.
Yeah. A very interesting thing with the compassion in physicians. I think the best decision I have ever made when we did our innovation was to put all the physicians in the same room. Now, I thought at the beginning it was silly, but then it turned out to be really good because I'm in the room, the other partners are in the room. I know about their kids. I know about their baseball games. I know about their dance recitals. I know who's sick, how they feel. You hear it by accident, as opposed to the way it used to be, where I had my own consultation room here. You had yours over there, becomes us and them, or boys and girls, or whatever teams you happen to make. So everybody's on the same team.
Yeah.
And we share desks. Nobody has their own desk.
See, my OCD would drive me nuts. I gotta have my desk organized. But yeah, that's a model that works really well, especially with the younger generations.
Well, they kind of know where the desk is.
Yes.
And they know that Rogo usually sits here and Riley sits there.
Yeah.
What? Like the dinner table, right? Doesn't
Yeah.
Your family sit at the same seat.
Yeah.
Nothing's been assigned.
Yes.
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 Just like that.
When they come home, they're upset if someone's sitting in their seat.
Yeah. Isn't that funny?
Yeah.
Yeah. That's
like
very
that.
true. And another one of your values at Ally is humility. Why is that important?
Because we all make mistakes. We're all not perfect. We all have something to learn from somebody else.
Right. And probably as a leader, the biggest mistake one can make is thinking they know it all.
Yeah, that was actually so freeing for me. When our COO left and I was looking at taking over, the day-to-day management of Ally, I didn't know if I could do it because, I didn't go through that business training. I don't have my MBA and, can I do that? And when I realized that I don't have to know everything, I just have to be able to listen, move obstacles out of the way, help people do their best. And I can be successful in doing that. It was so freeing.
Yeah. This MBA stuff is really, it's not important. If you have a good physician that has a lot of experience in the different areas of private practice, they're better than an MBA. I mean, I did the MBA not to learn the stuff. Every single project I've ever done for that program was based around the private practice. It just gives you a title, leverage, whatever.
Yeah. And then your other core value is empathy. How do you use empathy within the management team, again, outside of the exam room?
I guess the empathy and compassion answer are the same, right? Just
Okay.
listening, putting yourself in someone else's shoes, trying to understand where they're coming from, assuming good intentions.
Yeah. And it's always tough because I think people misunderstand empathy with making decisions. And sometimes you got to ask people to leave the bus. And in my mindset, I'm doing that person a favor because the job I have for them doesn't match their skill sets. And we're going to get more soured by the day because I'm not happy with the production and they can't produce. But letting go of someone's very difficult. But you can't let your empathy interfere with it. I think you're doing a harm to the organization and to the person that they can't go somewhere else. But people don't like it. They feel, I think that's like lacking in empathy.
I mean, it's always hard to sever a relationship or to ask somebody to leave. But like you said, sometimes that is the empathetic option.
Yeah.
because you know that somebody, can't be successful. And I always go back, it's very funny. My management team knows. I always go back to parenting. And I think running an organization is a lot, like parenting. Your children need to be successful. Not that we ever ask our children to leave us, right? But we
Yes.
want something for them to do, that makes them successful. It's important that you feel good about what you do, that you're able to succeed. And for children, that's school, and for adults, it's work.
Yes. And we do ask our children to leave, right? We prepare them to go to college and get the job and be independent and create a family of their own.
And then they come back.
And then they come back and they dump the grandchildren.
Yeah.
But we want them to leave. We want them to lead their own lives. That's a big deal about parenting, is creating that happy, successful, independent adult that's with you because they love you, not because they have to be there.
Yes, certainly want the people at Allied to be able to grow within the organization so they can get to that level, right? You go from being a staff member to being a director and a senior director, and being able to go above that. But if it benefits somebody to be in a different organization and that's better for them, then we have to figure out how to make that happen.
Absolutely. My understanding is that you're also very data driven when you make decisions, and you guys have a phenomenal dashboard that allows you to take that CEO look at all your metrics and make day-to-day decisions on things that need to be addressed.
Yeah, it's also good just for helping the doctors to understand where they are. Like, we all feel we're busy no matter how many patients we're seeing, for the most part, because the patients are getting more complicated, and you could stretch out that time with a given parent who needs you, but that doesn't necessarily translate into the overhead that you need to run your office. So when you have the data, it's easier for people to understand what you need them to do. And we spent probably the first, Allied is now 16 years. And, for at least the first 10, we had to justify the data to the physician. He would show them the data and they would say, I don't believe it. But,
Classic.
Right. But over
Classic.
time, and sometimes they were right, because it also depends on what variables you pull in. But over time, they've come to trust us. And the pandemic was actually very key in a lot of that, because as soon as the pandemic hit and the phone stopped ringing and our offices were empty, all of our divisions looked to us at home office and said, what do we do? How do we get through this? And it was the trust that we had built up over all the previous years that allowed them to do that. And, literally in lockstep, everybody did what we needed them to do, whether it was telehealth or cutting, your distributions, how much money you were taking home. And we got through the pandemic, healthier than before, from a financial aspect and a patient aspect and a satisfaction aspect and all of that. It's been really hard, though. In some ways we feel the pandemic is over, nobody's masking, but we're still feeling the reverberation of all of that work that the doctors had to put in. It's the ups and downs. You're full, you're empty. You can't find employees, right? The doctors are doing work that they didn't do. All of that, we're still recovering.
The Great Resignation. They actually have that article in the Contemporary Pediatrics that came out yesterday.
So that would be a good example of a place where you cannot make data-driven decisions. You have to make opinion or gut-based decisions, right? There was no playbook for the pandemic, and you just had to make the best choice you could for the team.
Yeah. We had no data. We didn't know
Right.
what was going to happen the next day.
Right. So data is great, but sometimes you just have to go with your gut.
Oh, yeah. And you really can make data show whatever you want in many instances,
Yeah.
right? It's which data you look at and where you put the emphasis. So a lot of it is knowing the direction you want to go.
Yeah. Allied survived the pandemics. What do you think they did differently? Because I'm sure many practices that just shut down and closed. You guys did something different.
We had good good people who helped us keep an eye on our finances. We got we were doing telemed for 2 years before the pandemic hit. But a lot of our offices didn't love it. They didn't really want to do it. And within a month, we got every office set up on telemed. We made that possible. And I think that was huge.
Yeah.
And then to control money, control expenses.
So as they say, you pivoted and you adapted.
We did.
Yeah. That's hard for a big organization to do.
Yeah. Well, I guess the people that didn't pivot or just followed rules and didn't think outside the box of what can we do. I mean, how many people did you see in the parking lot or outdoors or some silly thing like that?
Sure.
I mean, I showed you her when you went to the old office. I showed you where the catwalk where we saw patients outside and we did COVID test on, and the tent that we did in the sidewalk for well care and virtual care.
Yeah.
And silly now, but it was real.
Yep.
Like the best part of Allied for me has always been the other physicians. Getting in a room and talking or, Zooming at that point with people that are bright and passionate. It's always been the best part of Allied. And especially during the pandemic, there was just so much work to do. You couldn't do it all. Finding PPE, figuring out protocols, what's safe, what tests do you order? We never ordered the finger stick antibody test that Peds was doing. And, that was a big discussion because that was a way, early on to get patients to come back in. But clinically, we knew it didn't have a lot of value. And, so having people and having all those discussions and being able to assign people to different things. And one of the things we did early on was our CMO was the one that all information came from. So, anybody could send stuff in, we could work together, but it all came from one place. So we knew that it was easier for people to digest when they weren't getting, 5 different emails from different people.
It was very interesting with you mentioned the finger stick and, antibody testing. As a physician, I would have to agree with you. Clinically, it had no value. It didn't really do anything. But if you did it, it was the best thing for the families and their patients. They were. I knew my kid had COVID back in March. My whole family got sick before they were doing testing, and I just stayed home. Psychologically, it was worth it, right? I guess. I don't know. Socially, it was good.
We make choices.
Yeah.
We make clinical choices every day. And that's what's really nice about Allied is that doctors can make their own clinical choices.
Yeah.
But we give guidance.
Yeah.
If somebody really wanted to do that test, we weren't going to tell them they couldn't order it, but we weren't, as an organization, going to look at it and get a better price.
Right.
Okay.
Or encourage it.
And as a leader, how do you keep your eye on customer service and the physician's need so that you get great pediatricians and children and parents interaction in the exam room?
Well, Allied is lucky. We actually have a customer experience officer and somebody who's paying attention to the customer journey. But for me, I think the key thing is availability. My patients contact me regularly to tell me, what they need, what they're not getting. They find me on Facebook, and I'm really happy to have those conversations. So I'm not out of the loop. The same way, with the doctors, I hear things within my own practice about where pain points are, and other people know that I'm available. So when you hear it, then you kind of feel obligated to do something about it.
How do you set goals of your leadership team?
I don't set goals by myself. We sit down together and we decide where we want to go, and we figure out what the goals are and in what timetable they're achievable. And again, going back to pediatrics, parents will say things like, I don't need my children to get A's. I just want them to, do the best they can. And I point out that you can't do the best you can in everything, right? You're making choices. If you want to do the best you can in science, you might be giving up a little something in English. And it's the same thing in business. We could create goals, but we try not to work in silos, right? So if HR has a goal, but they might need IT to do something to help them achieve that goal, but IT has a different goal. And so we all have to work together to figure out, what those goals are. And that's what we do. We sit down together and we figure out what our goals are.
And you're flexible with the time. You don't try to manage goals in 90 days or 120 days.
Short-term goals and long-term goals.
Okay.
It depends on what we need. There's some things that have to happen. You have an IT upgrade, it has to happen by a certain date because we need outside help to do it, and that's what we've committed to. Or they're no longer supporting XYZ, and then everybody has to be on board. And even if that means that people outside of IT are helping to get something done or are putting off their needs and thereby having to postpone their goals to make something.
What about micromanaging? That's a problem that a lot of physicians deal with. They have to do everything. You know the type.
It's interesting. I used to know everything going on in Allied, but the fact that I don't now means we're doing so many more wonderful things.
Yes.
I can't know everything because that would be limiting to what we're doing.
Yeah. The one good thing that I did learn at the MBA program is where they talked about CEOs. And there was a CEO of some hospital. He would go around every month to each department and ask, what is it about your department that I don't know that I need to know? And he would ask the staff and they would tell him what the problems are.
Yes.
So that was a good thing.
Yeah.
I think that was it. Of course, that's that.
Yeah.
Then that's where it must have been that.
And the other one is,
He would walk through the hallways and find the person who's emptying the garbage cans and ask them,
Mhm.
What don't I know that I need to know? How can I help you? I think about that. Also.
Yeah.
A lot.
Yeah.
It's important. Yeah. It was a powerful thing. Yeah. It impressed both of us. So it must be something to it.
no, absolutely. Absolutely. Do you get out to the different practices just to see how they're running at any given time?
I don't. Our teams do, but I don't.
Okay. What haven't we asked you that you think is important for people to hear about as they contemplate pediatrics, pediatric management?
I think that all physicians are leaders, even the ones in the hospital. Like you have a team and you're leading them, but certainly in private practice. If you're running a private practice, you're a leader. Even if you're employed by a private practice, but you're the one there, Friday night or Saturday morning and a partner's not there and something happens, they're going to turn to the physician that's there to get things done. And we're not trained for it during medical school. And, they're talking about shortening medical school. And I see the point of that and the finances of it. But there's so much that we need to understand about healthcare financing and advocacy that we don't learn in medical school. And I think that we should, take it upon ourselves to learn some of it. And as important as reading a journal on anemia is, I think listening to a podcast on leadership when you drive to work would be good.
The children don't learn anything in medical school about business or private practice.
No.
We have students that come in to our office once a month and they stay with me all month and they finish and they said, I never thought pediatric private practice could be like this.
Yeah.
So that's pretty amazing.
That's a pretty tough structural problem because, organized medicine works like the Vatican. The Pope or the department, tells the bishops what to do, and the bishops go down and tell the people in the church what to do. And there's not, there's no committees, there's no feedback loop. I'm just the Pope with the department, the chairman of the pediatrics at whatever, Baylor College of Medicine. And my ideas are great. End of discussion. And I don't want the young doctors, the doctors to be contaminated by industry or people who want to talk to them about business, because that's just not what we do here. And that's been the case when I trained, and it continues to be the case. It's very hierarchical and stiff. It doesn't change.
are not.
Correct.
in this country.
But there are some people that are still in charge, like you, like me, like
Yeah.
Herb.
But overall, we've seeded.
We seeded that,
control. That is,
and that's been doctors cannibalizing doctors. So what have we done about it? We're inviting medical students that want to be pediatricians to join our happy hour and hear about the pitfalls of contracting, their personal finances, how doctors are succeeding being pediatricians, how they're passionate, how they get up with a spring on their step to go see their patients. What a nice lifestyle is.
Right.
Um,
Well, they
and-
have to see what we do
Yes.
because they're told that it's no good.
It's no good.
But let me tell you,
Don't go into
I got the best
pediatrics.
job. I really do, and I work full time.
Yeah, don't go into pediatrics. And if you go into pediatrics, for God's sake, don't go into private practice. You won't survive. Right? That's what they're
We're all
told every day,
examples of
right?
Survival.
Right?
Yeah.
And then you see, for example, Morgan today in the coaching meeting.
Mhm.
She's full of passion to be
Yeah.
a pediatrician. She's a third-year medical student, and she's full of passion. And when Susan Serrata said to her, "This is the best job ever. There's not a day in my life I don't come home happy." That's what the young kids need to
That's
hear.
what they need to hear. And
That's
that's the whole point of our podcast
And-
is let's elevate great physicians and
Yes.
share good stories instead of the darn doom and gloom that I'm tired of hearing.
Yes. And we need to reach the young people.
they're the genesis of this podcast. And it started, right, with a lot of people complaining. And Herb, you said, we got to do something. Let's start a podcast.
Yeah.
And then you did it.
Yeah.
We did it.
It's not
Well,
that big of a
joined
deal.
in.
It's very simple.
I didn't do it. We did it. We did it because George has been extremely supportive, and the listserv has been more than supportive. So it's really been a community that's been built around a simple idea.
Yeah.
Let's sit down and have a conversation.
Yep.
Let's make the effort to drive up to Long Island and see my two friends. Right? This is simple ideas that
Yeah.
we don't take time to do anymore.
We could have done this through Zoom
Yeah,
from Washington
it's not the
and
same.
everybody's office, but it's not the same.
It's not the same.
That's to know about. I think it's not just leadership. It's creating a culture within your organization
Yes,
for everybody to
absolutely.
thrive. And I never believed in the softer side of things, 20 years ago. It was, get things done and, no matter how you had to. And culture was this very amorphous thing. And, I'm now a believer in Jen Scher, who's she was our CMO. We've actually appointed her as the Chief Wellness Officer. And Leslie Baker, we have our Chief Experience Officer. It's so key, the culture. And, in order to work on that, the best thing to do is get control of yourself, work on yourself. Like, we can't always influence the top of an organization. It's great when the CEO is on board because that's so important. But learn to, your own emotional intelligence and how to work with the people around you. And I think that's key to making any enterprise survive, including the private practice.
Absolutely.
Private practice will survive. I assure you of that. It's
Yes.
coming around. It's coming back.
Yes. But we need to mentor the young people
yeah.
so that they're thriving and successful and, have a long career.
When is our next pediatric alum happy hour?
I think it's May 13th.
Yeah,
Saturday.
we'll send it out.
We'll send it out. Well, Kerry, you can't imagine the pleasure it is to be sitting next to you in Long Island. Been looking forward to this for a long time.
I'm so glad that the trip and we got to do this in person.
Thank you. Thank you for your time. George?
Thank you. I
Thank
see you
you.
every Tuesday.
That's true.
Thank you. Yeah.
Is it right there? Thank you for listening. This has been a production of the Pediatric Lounge. On the show notes, you will find links to our co-host and other important notes, as well as a timetable of the topics discussed today. Don't forget to follow us on social media and subscribe to wherever you listen to your podcast. Leave us a great review, as it helps us greatly. In the meantime, we will see you next week. The Pediatric Lounge. The conversations are not intended as medical advice, and the opinions expressed are solely those of the host and the guest.